Tattoo ink could trigger blood cancer, the hidden danger of tattoo ink. However, as tattoos become more common, there are increasing concerns about the safety of tattoo inks and the potential health risks, including the risk of cancer. This article explains what is in tattoo inks, how they might pose health risks, and what science currently knows about these risks. Tattoo inks mainly consist of two parts: pigments and carriers. Pigments, organic pigments. These are carbon-based compounds that give bright and vivid colors. Examples include azo compounds, polycyclic compounds, and quinacridone. Inorganic pigments. These include metal oxides and metal salts, which also add color. Common examples are titanium dioxide, white, chromium oxide, green, and iron oxides, red, brown. Carriers are liquids that help carry the pigment into the skin. They can include water, glycerin, alcohols, and other substances that keep the pigment evenly mixed and prevent contamination. Potential health risks of tattoo inks. Tattoo inks can pose several health risks due to the chemicals they contain. These risks include allergic reactions, infections, and more severe long-term effects like cancer. If you enjoy our content, don't forget to hit that subscribe button and join our community. By subscribing, you'll stay updated with all our latest videos and exclusive content. Plus, it helps support our channel so we can keep bringing you the best content possible. Allergic reactions and infections. Some individuals may have allergic reactions to certain pigments, leading to itching, redness, and swelling. Poor hygiene practices during tattooing can result in bacterial infections. Carcinogenic risks. Organic pigments. Some organic pigments, particularly azo compounds, can break down into potentially carcinogenic compounds when exposed to UV light or when metabolized by the body. Inorganic pigments. Inorganic pigments, especially those containing metals, can be toxic. For instance, chromium and nickel are known to be carcinogenic in certain forms and exposures. Contaminants and byproducts. Tattoo inks can sometimes contain contaminants or byproducts that are harmful. These can include heavy metals, such as lead and arsenic, which are known carcinogens. How tattoo inks might cause cancer. The concern about tattoo inks causing cancer primarily revolves around the behavior of certain pigments and contaminants in the body. When tattoo ink is injected into the skin, it doesn't just stay in place. It can travel to other parts of the body. Studies have found pigment particles in lymph nodes, which are crucial for the body's immune response. Metabolic breakdown. Some pigments can break down into toxic or carcinogenic compounds. For example, azo pigments can degrade into aromatic amines, which are known carcinogens. UV light exposure. Exposure to sunlight can cause certain pigments to degrade into harmful substances. UV light can break down some tattoo pigments into potentially toxic and carcinogenic molecules. Chronic inflammation. Tattoos can cause long-term inflammation in the skin, which, over time, can contribute to the development of cancer. Chronic inflammation is a known risk factor for various types of cancer. Current scientific understanding and regulation. The scientific community is actively researching the safety of tattoo inks, but there is still much that we don't know. Some studies have shown a link between tattoo inks and cancer, while others have not found a significant risk. This lack of consensus means that more research is needed to fully understand the long-term health effects of tattoo inks. Regulation of tattoo inks varies widely across the world. In some countries, tattoo inks are subject to strict regulations, while in others, there is little oversight. The European Union, for example, has banned several hazardous substances in tattoo inks and requires safety testing. In contrast, regulations in the United States are less stringent, with the FDA considering tattoo inks as cosmetics but not actively regulating them unless there is evidence of safety issues. What can you do? If you are considering getting a tattoo, there are several steps you can take to minimize your risk. Research your tattoo artist and parlor. Ensure they follow proper hygiene practices and use high-quality, safe inks. Ask about the ink. Inquire about the ingredients in the tattoo ink and whether they comply with safety regulations. Consider the risks. Be aware of the potential risks and make an informed decision. If you have concerns about certain pigments, discuss them with your tattoo artist. Monitor your health. After getting a tattoo, monitor your skin for any unusual changes and seek medical advice if you notice anything concerning. While tattoos are a cherished form of body art, it's crucial to be aware of the potential risks associated with tattoo inks. Understanding the components of tattoo inks, how they might pose health risks, and the current state of scientific research can help you make informed decisions. As with many health-related issues, knowledge and caution are your best tools in minimizing risk. If you enjoy our content, don't forget to hit that subscribe button and join our community. By subscribing, you'll stay updated with all our latest videos and exclusive content. Plus, it helps support our channel so we can keep bringing you the best content possible. Thanks for watching and subscribing.